I live in Monterey. I'm retired. I've been a COPA leader for a long time and looking forward to talking with you. I belong to St. Mary's by the Sea Episcopal Church in Pacific Grove. And it's in COPA, it is the institution that I belong to that really has the membership. It is St. Mary's that is the member of COPA, and I'm a COPA leader from St. Mary's. I've been involved with what is now COPA since the year 2000. My first job then in COPA was to find people in my congregation who were interested in this kind of work, and then to persuade the parish council, the vestry, to formally join and to put up the money to make St. Mary's a member in COPA. At the time I started getting connected to COPA, I thought COPA was an issue organization that does things to make the world better, and it is that. But I've been doing this a long time now, and I've seen issues come and go. That something comes up, we work on it, we either succeed or we don't, and then we move on to something else. So that now it's much more salient to me that we're a leadership development organization. We're a graduate school for people who want to participate in public life. There's a rich mix of people of race, class, education, geography, people with entirely different kinds of life experience. And that makes all the difference for the way the organization functions, for the kinds of things we work on, for what's important to us. We do our work by story. We do our work by individual meetings. We have had more than 2,000 discussions now with people in small groups, talking to them about what their life has been, what their experience has been with work, with what their experience has been with different kinds of employers, with finding work, with what kinds of benefits or salaries were involved with the work and trying to find other work, what it is that holds them back for getting better kinds of jobs, all those kinds of things. We've had more than 2,000 of those conversations. What we've learned is much richer than what you would get if you tried to give those people a questionnaire. And what's more important is by having these conversations with 2,000 people, we have found people who want to do something about it. So we've found some remarkable leaders in the course of these conversations, asking people about their own experience with work. It's a part of our culture to have a commitment to each other's growth and development. Before we go into battle with someone else together, we want to have a relationship. We're always looking for leaders. We're always trying to say, what's the next step for Logan? Logan has been coming for several weeks now. Let's involve him in giving him this role in the next meeting. And it's always tuned to you. COPA has always emphasized, we've always been proud of being countercultural in the sense of valuing face-to-face conversations. So here comes COVID. One is county-wide, right? So you really want to know what's going on at the southern end of the county, and you want to know what's going on at the northern end of Santa Cruz County, all at once. And we want to know what's going on with people who don't have very good internet connectivity, people who have never used Zoom. So the first task was to get people online and to get them able to use Zoom. We did that, but we started out having Zoom meetings every Tuesday and Thursday night, where people would come from all over Monterey, all over Monterey and Santa Cruz County, and would bring stories about how COVID was affecting their families. Right. So some people would come into the call and say, yeah, my husband got laid off this week. The restaurant where he worked closed. Then we also started hearing stories about how crazy the county's response to COVID was. Like, if you tested positive, you were told to isolate. You live in a household with 9 other people, and there's no place for you to isolate. So the county, of course, has alternative housing. The office that you need to talk to get alternative housing is open from 9 to 5, Monday through Friday. So if you find out you're positive late on a Friday afternoon, there's no way you're going to get housing. Then the emergency services office used to say, well, we want to open this up, so just come to us with a prescription from your doctor, right? Essentially a note from your doctor saying that you need alternative housing. Many people in the county, maybe more than half of the people in the county, do not have a family physician, do not have a primary care physician. So it was a case where the health department was well-meaning professional people who were making programs for people like themselves, not for the people who were most at risk of COVID. So we listened to these stories for weeks, Logan, and it was really coming to a point where we had heard the same stories so many times that we were thinking it was no longer, you'd listen to 6 stories that night and 5 of them you would have heard before. But nevertheless, it just, it grabbed me by the heart. Marina and I had worked together on many projects. So I called her to say, Maria Elena, I would really like COPA to focus on this issue. We've never had a pandemic team in COPA, but what we did have is this network of relationships. I said, can you imagine that we could work together and try and do something about these stories that we're hearing? And she was interested. So and she was also interested in talking to other people in her network of relationships about their interest in working on this, as was I. So we started having separate meetings of people who were trying to formulate a response to COVID. So we got meetings with the health director and with Dr. Moreno and some other people from the health department, and we told them these stories. They met with us whenever we asked. They were courteous, but they were not responsive. Then we started bringing these stories to the supervisors. We've worked with the county supervisors on other projects, even health-related projects. So we got appointments with all 5 supervisors, and we started bringing people who could tell these stories. By Christmas time in 2020, by that time, we had made a proposal that the county create this community health worker program, and that the county funded largely with federal COVID response funds, and that doing this, they would hire 100 health workers. So in Christmas week of December 2020, the board called a special meeting with one item on the agenda. And the item was our proposal to create this community health worker program that would hire 100 people from the community who would be focused on being trusted advisors to the community to get COVID under control. They called it VITA, but COPA always had we called our team breaking the chain. The idea was we were interested in anything that would help get COVID under control, not just the community health worker program. So before the community health worker program, Breaking the Chain had sponsored Zoom training opportunities in congregations to help people know what the current thinking was about how to protect yourself and your family from COVID. We learned from hearing these stories the practical things like, I'm a parent, I've got young kids, I need diapers, and I'm supposed to be isolating. Am I supposed to go down to the supermarket, bringing my kids and go shopping, right? I'm supposed to be isolating. That there were all these gaps when you talk to people. Mujeres hired a number of the community health workers. COPA never hired community health workers, but some COPA organizations like Mujeres, like Building Healthy Communities, like CBDIO, an organization that works primarily with indigenous people. Those organizations hired the community health workers. Mujeres, though, continued, reacting to those stories. So Mujeres set up a hotline. You could call, and if you needed diapers on a Saturday afternoon, someone would bring them to your door yet on Saturday afternoon. And by the end of the program, we had gotten so integrated into the testing system in the county that people in my congregation in Pacific Grove, they would, if it was hard to find a test on the peninsula, they would drive to Salinas and get tested. they turned out they were positive. Somebody from Mujeres would call somebody in Pacific Grove saying, I understand you tested positive for COVID. Is there anything you need? Is there anything we can do to help you isolate successfully? And they were astounded. They thought the government cares about me and whether I can recover properly from COVID. It was an amazing. They were amazed that the government was doing that. Well, in fact, it was Mujeres through COPA or with COPA that was able to improve the way the government was responding